Welcome to the MRCS Bytes session on blood supply to the heart. Today, we'll dive into this topic and explore the common questions tested during the MRCS Part B exam. For more information and full course, please visit mrcsbytes.com. Right coronary artery. This arises from the right, anterior, aortic sinus and runs between the pulmonary trunk and the right auricle. It gives off a marginal branch at the junction of the posterior interventricular groove and atrioventricular sulcus and continues as the posterior interventricular artery. The posterior interventricular artery continues in the interventricular groove and anastomoses with the anterior interventricular artery. The marginal branch descends over the front of the ventricle. It supplies the right ventricle, sinoatrial node, 60%, and atrioventricular node, and part of the left ventricle. Left coronary artery. This arises from the left, posterior, aortic sinus and divides into the circumflex and anterior interventricular, left anterior descending, artery on reaching the atrioventricular groove. The circumflex travels in the atrioventricular sulcus to anastomose with the right coronary artery. The anterior interventricular, left anterior descending, travels in the interventricular groove to anastomose with the posterior interventricular artery. The left coronary is larger than the right and supplies the left ventricle. The anastomoses are poor, and in acute occlusion, these arteries are functional end arteries. Venous drainage. All veins except for the anterior cardiac veins drain into the coronary sinus, which opens into the posterior wall of the right atrium. The main tributaries are the great, middle, and small cardiac veins. The great cardiac vein travels with the anterior interventricular artery and drains into the left, proximal aspect of, coronary sinus. The middle cardiac vein travels with the posterior interventricular artery and also drains into the coronary sinus. The small cardiac vein also drains into the coronary sinus proximally. The right marginal vein travels along the inferior surface of the heart and drains into the small cardiac vein. The anterior cardiac veins run across the surface of the right ventricle and drain directly into the right atrium. For more MRCS Part B resources, please visit mrcsbytes.com.